Hi there. This is Core Tan, and welcome to my channel. Today's reading is about rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition can damage a wide variety of body systems, including the skin, eyes, lungs, heart and blood vessels. An autoimmune disorder, rheumatoid arthritis, occurs when your immune system mistakenly attacks your own body's tissues. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. The inflammation associated with rheumatoid arthritis is what can damage other parts of the body as well. While new types of medications have improved treatment options dramatically, severe rheumatoid arthritis can still cause physical disabilities. Symptoms. What are usually the first signs of rheumatoid arthritis? Early signs of rheumatoid arthritis: fatigue, morning stiffness, joint stiffness, pain, swelling, fever, numbness and tingling, limited motion, loss of appetite. Early rheumatoid arthritis tends to affect your smaller joints first, particularly the joints that attach your fingers to your hands and your toes to your feet. As the disease progresses, symptoms often spread to the wrists, knees, ankles, elbows, hips and shoulders. In most cases, symptoms occur in the same joints on both sides of your body. About 40% of people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. Areas that may be affected include skin, eyes, lungs, heart, kidneys, salivary glands, nerve tissue, bone marrow, blood vessels. Rheumatoid arthritis signs and symptoms may vary in severity and may even come and go. Periods of increased disease activity, called flares, alternate with periods of relative remission, when the swelling and pain fade or disappear. Over time, rheumatoid arthritis can cause joints to deform and shift out of place. When to see a doctor? Make an appointment with your doctor if you have persistent discomfort and swelling in your joints. Causes. Doctors don't know what starts this process, although a genetic component appears likely. While your genes don't actually cause rheumatoid arthritis, they can make you more likely to react to environmental factors, such as infection with certain viruses and bacteria, that may trigger the disease. Risk factors. Factors that may increase your risk of rheumatoid arthritis include your sex. Women are more likely than men to develop rheumatoid arthritis. Age. Rheumatoid arthritis can occur at any age, but it most commonly begins in middle age. Family history. If a member of your family has rheumatoid arthritis, you may have an increased risk of the disease. Smoking. Cigarette smoking increases your risk of developing rheumatoid arthritis, particularly if you have a genetic predisposition for developing the disease. Smoking also appears to be associated with greater disease severity. Excess weight. People who are overweight appear to be at a somewhat higher risk of developing rheumatoid arthritis. Complications. Rheumatoid arthritis increases your risk of developing osteoporosis. Rheumatoid arthritis itself, along with some medications used for treating rheumatoid arthritis, can increase your risk of osteoporosis, a condition that weakens your bones and makes them more prone to fracture. Rheumatoid nodules. These firm bumps of tissue most commonly form around pressure points, such as the elbows. However, these nodules can form anywhere in the body, including the heart and lungs. Dry eyes and mouth. People who have rheumatoid arthritis are much more likely to develop Sjogren's syndrome, a disorder that decreases the amount of moisture in the eyes and mouth. Infections. Rheumatoid arthritis itself and many of the medications used to combat it can impair the immune system, leading to increased infections. Protect yourself with vaccinations to prevent diseases such as influenza, pneumonia, shingles and COVID-19. Abnormal body composition. The proportion of fat to lean mass is often higher in people who have rheumatoid arthritis, even in those who have a normal body mass index, BMI. Carpal tunnel syndrome. If rheumatoid arthritis affects your wrists, the inflammation can compress the nerve that serves most of your hand and fingers. Heart problems. Rheumatoid arthritis can increase your risk of hardened and blocked arteries, as well as inflammation of the sac that encloses your heart. Lung disease. People with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissues, which can lead to progressive shortness of breath. Lymphoma. Rheumatoid arthritis increases the risk of lymphoma, a group of blood cancers that develop in the lymph system. What is the best treatment for rheumatoid arthritis? Methotrexate is usually the first medicine given for rheumatoid arthritis, often with another DMARD and a short course of steroids, corticosteroids, to relieve any pain. These may be combined with biological treatments. The DMARDs that may be used include methotrexate, leflunomide, hydroxychloroquine, sulfasalazine. What foods are bad for rheumatoid arthritis? Foods you should avoid with rheumatoid arthritis: grilled, broiled, or fried meats, and other fried foods. Fatty foods full of omega-6 fatty acids. Sugars and refined carbohydrates. Preservatives and flavor enhancers. Added sugars. You should limit your sugar intake no matter what, but especially if you have arthritis. Processed and red meats. Gluten-containing foods. Highly processed foods. Alcohol. Certain vegetable oils. Foods high in salt. What organs are affected by rheumatoid arthritis? Rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. What is the life expectancy of rheumatoid arthritis? An exact life expectancy is almost impossible to predict due to the varying nature of the disease. In general, patients can expect that the rheumatoid arthritis life expectancy could be shortened by roughly 10 years to as many as 15 years. Painful joints also make it hard to exercise, leading to weight gain. Being overweight may make people with RA more likely to develop high cholesterol, diabetes, heart disease, and high blood pressure. Getting an accurate diagnosis as soon as possible is the first step to treating RA effectively. A doctor with specialized training in treating arthritis, called a rheumatologist, is the best person to make a correct diagnosis, using medical history, a physical examination, and lab tests. Medical history. The doctor will ask about joint symptoms, pain, tenderness, stiffness, difficulty moving, when they started, if they come and go, how severe they are, what actions make them better or worse, and whether family members have RA or another autoimmune disease. Physical examination. Blood tests. The blood tests look for inflammation and blood proteins, antibodies, that are linked to RA. Imaging tests. RA can cause the ends of the bones within a joint to wear down, erosions. An X-ray, ultrasound, or MRI, magnetic resonance imaging, scan can look for erosions. But if they don't show up on the first tests, that could mean RA is in an early stage and hasn't damaged bone yet. Imaging results can also show how well treatment is working. The goals of RA treatment are to stop inflammation or reduce it to the lowest possible level, put disease in remission, relieve symptoms, prevent joint and organ damage, improve function and overall well-being, reduce long-term complications. To meet these goals, the doctor will follow these strategies: early, aggressive treatment, to reduce or stop inflammation as quickly as possible; targeting remission or another goal, treat to target, work toward little or no signs or symptoms of active inflammation; tight control, keep inflammation at the lowest level possible. Women are 3 times more likely than men to develop RA. In women, RA most commonly begins between ages 30 and 60. RA is rare in men under the age of 45. Self-care, healthy eating. A balanced, nutritious diet consisting of the recommended amounts of all the food groups helps promote wellness and makes it easier to maintain a healthy weight. Balancing activity with rest. Rest is important when RA is active, and joints feel painful, swollen or stiff. Rest helps reduce inflammation and fatigue that can come with a flare. Taking breaks throughout the day protects joints and preserves energy. Daily movement. Even when you don't have time to exercise, try to make movement part of your everyday routine. Use the stairs instead of taking the elevator. Park in a spot that makes you walk a bit to enter a building. Take the longer way to a meeting in your office. Hot and cold treatments. Heat treatments, such as heat pads or warm baths, tend to work best for soothing stiff joints and tired muscles. Cold is best for acute pain and swollen joints. It can numb painful areas and reduce inflammation. Topical products. These creams, gels or stick-on patches can ease the pain in a joint or muscle. Some contain the medicine that you can get in a pill, and others use ingredients that irritate your nerves to distract from pain. Stress reduction and complementary therapies. There are different ways to relax and stop focusing on pain. They include meditation, deep breathing, and thinking about images in your mind that make you feel happy. Massage can help reduce pain, relax sore muscles and ease stress or anxiety. Acupuncture involves inserting fine needles into the body along special points to relieve pain. If you don't like needles, acupressure uses firm pressure instead. Supplements. Studies show that turmeric and omega-3 fish oil supplements may help with rheumatoid arthritis pain and morning stiffness. However, talk with a doctor before taking any supplement to discuss side effects and how it may affect other medicines you are taking. Thank you. Subscribe today. Salamat.